This is how JAK inhibitors can help your chronic pain, what their limitations are, and the natural alternatives we have to them. When a cytokine attaches itself to a receptor on your cell membrane, it activates a family of enzymes called Janus kinase, or JAK. JAK then puts a phosphate group onto a protein called STAT, hence why a JAK inhibitor is sometimes called a JAK-STAT inhibitor. That STAT protein then goes to the nucleus to either turn on genes that create more inflammation or help fight inflammation. Whether the genes that we're turning on or off are pro-inflammatory or anti-inflammatory have to do with whether that initial cytokine was pro-inflammatory or anti-inflammatory. A JAK inhibitor medication just puts a wall right here between JAK and STAT so that we cannot turn on any pro-inflammatory genes, which seems like a great idea, but I think you're starting to see the problem here. One, this medication does not do anything about the production of this pro-inflammatory cytokine. Those are still forming on their own and are creating inflammation on their own. But if we put up this wall here, that also means that we cannot create any anti-inflammatory, we cannot turn on any anti-inflammatory genes, which means the inflammation that's sitting around, we're not going to be able to get rid of. Not to mention that we're just suppressing your immune system, which is never a good idea. So now we're increasing the risk of infections. We actually increase the risk of heart attacks and blood clots. And we also slightly elevate your risk of contracting certain cancers, such as lymphoma and non-melanoma skin cancers. So the alternative is to focus on treating the epigenetics that would otherwise be turning these pro and anti-inflammatory genes on and off. And we do so largely through nutrition. We treat gut permeability, chronic infections, sleep regulation, blood sugar stability, looking at environmental triggers, stress, treating your autonomic nervous system dysregulation. These are all things that we've been talking about in past videos. Go back, give them a watch, and connect the dots yourself.